One thing that I just want to touch on and highlight about the budget resolution, true in the original House budget resolution as well as this one, are the devastating cuts that it calls for funding for services that people rely on, including Medicaid, and that is coming to our committee. Medicaid is a lifeline that 1 in 4 Americans relies on for their health care, and that matters to them, but it matters to all Americans, and we need to be clear about that. There are more than 70 million people in every state in the country that rely on Medicare to receive health care. In my home state of Texas, Medicaid provides health care to 4.8 million people. And Texas has very narrowly defined eligibility for Medicaid. If you are an adult under 65 that is not disabled or raising a child, you are ineligible for Medicaid, no matter how low your income is. So many people in Texas don't even qualify for Medicaid. But the people who do are children, adults with disabilities, people living in nursing homes, and moms who've just given birth to their newborn babies. And I should also add, as we have this conversation about Medicaid, that 57% of the adults in Texas who rely on Medicaid are working. So despite these narrow limits in my district, the 7th Congressional District in Houston, 110,000 of my constituents rely on Medicaid, and it matters. It matters to the people who are relying on Medicaid for their health care, but the harm doesn't stop there. It matters to everyone who is relying on these systems. Just a few weeks ago in one of our hearings, I asked a witness in our hearing, what does it mean that Medicaid covers 50% of the births in Texas? What will cutting Medicaid mean? And they said, well, it will have devastating consequences for the people who rely on Medicaid to pay for those births, but it will also mean that hospitals across the state can't afford to keep their labor and delivery units open, period. That everyone, whether you have private insurance or not, is not going to be able to get to possibly the nearest hospital. You might have to go hundreds of miles to deliver your baby. So there's really no way to overstate the impacts that this is going to have on every single American. And this is just one of the many cuts, but it's an important cut. There's no way that you can cut billions of dollars from the Energy and Commerce Committee without cutting Medicaid. Our constituents need us, rely on us, and expect us to stand up for them, and that is what House Democrats are doing. It is time that our Republican colleagues join us in rejecting these devastating cuts, in standing up for their constituents and standing up to President Trump about these terrible policy ideas that are going to continue to make life more expensive and harder for their constituents and for people across the country. So again, I thank you, Assistant Democratic Leader Neguse, for your leadership in bringing us together to talk about these important issues today. And I will now turn the podium over to my colleague on the Energy and Commerce Committee, Representative Kim Schreier.